Hello, my name is Dr. David Walker, and I will be presenting our study entitled Prevalence and Predictors of Cumulative Anticholinergic Burden Among Recently Admitted Long-Stay Nursing Home Residents with Overactive Bladder. The study was sponsored by Astellas Pharmaceuticals. First-line pharmacotherapy for overactive bladder commonly comprises antimuscarinics, and among older adults, their use must be carefully considered due to the known impacts of anticholinergic burden. Overactive bladder is prevalent among nursing home residents, but little is known regarding the extent of the burden they experience. Given the concerns about anticholinergic burden among older adults, this study design sought to characterize the prevalence, distribution, and predictors of anticholinergic burden among long-stay nursing home residents with overactive bladder. The study involved retrospective analysis of the minimum data set linked to Medicare claims data from 2013 to 2015. Eligible patients were long-stay nursing home residents with overactive bladder. Anticholinergic medication use was measured using the Anticholinergic Burden Scale, ACB, and cumulative anticholinergic burden assessed using the SDACE measure was categorized as no, low, moderate, or high burden. The Anderson Behavioral Model, ABM, was used to identify associated predisposing, enabling, and needs factors associated with high anticholinergic burden. The prevalence and distribution of anticholinergic burden was summarized. Predictors of increased anticholinergic burden were identified using multivariable logistic regression models. Approximately 124,000 long-stay nursing home residents with overactive bladder were identified. 45% were over 85 years old, 75% were female, and 87% were non-Hispanic white. Most of these patients had at least some level of anticholinergic burden. For predisposing factors, based on the output of both regression models, older age was associated with a lower odds of moderate or high anticholinergic burden. Female sex was positively associated with moderate or high anticholinergic burden, and Blacks, Hispanics, and other racial groups were less likely to have moderate to high burden compared to non-Hispanic whites. For enabling factors, dual eligibility increased the likelihood of having moderate and high burden, and the odds of having moderate to high burden was lower among those located in the Northeast and West regions compared to the South, as well as residents in urban areas compared to rural areas. Across the model, several need factors increase the odds, while cognitive impairment reduce the odds of having moderate to high anticholinergic burden. In summary, results suggest that nearly 90% of long-stay nursing home residents with overactive bladder were exposed to varying levels of anticholinergic burden. Several factors were strongly associated with higher levels of anticholinergic burden, including female sex, being white, and the presence of several common comorbidities. In conclusion, anticholinergic burden is prevalent among long-stay nursing home residents with overactive bladder. It raises concerns regarding prescribing practices in these patients because of their potential adverse effects, particularly among those with underlying comorbidities.